Good afternoon, and I'm very happy to have with us Dr. Meetu, who has very kindly agreed to do a live session with us on pink eye. She is practicing as a consultant ophthalmologist at Cosmos Eye Care. She has done her residency from Dr. Ram Manohar Lohia Hospital, New Delhi, and ICO from UK Awards. She has won the Haryana Garima Awards 2019 and many others. So, Dr. Meetu, thank you so much for being here and welcome.
Thank you, Nidhi. A very warm good afternoon to whoever is able to connect with us. The real hot topic of today is conjunctivitis. We have an ongoing epidemic. We're staring at one. And to the extent that there is at least one patient in every other household, so we can't ignore and we need to be aware. So this session is dedicated to conjunctivitis, or the pink eye that we usually call it. It's also called as eye flu, and in Hindi it's called aankh aana. Now, conjunctiva is nothing but it's a layer that covers the white portion of the eye. Any inflammation or infection of this is termed as conjunctivitis. Conjunctivitis could be divided broadly into two categories, an infective and non-infective one. For today, we're only focusing at the infective category, which we are looking at. Now, to start with, it's a very common occurrence during this season, the monsoon season. We generally see a lot of cases, but this time there have been almost triple the number of cases from last year. Thanks to the ongoing floods, the scenario out there is quite bad. Now, it is a viral infection. It involves not only the eye, but also the respiratory passage, the upper respiratory, and we might have fever as well. So let me just focus at our organ of interest today, which is the eye. Now, patients can be of any age group, right from the newborn to the geriatric age group. So there is no age limitation there because, as we know, it's a viral infection. Everybody is prone to it. Patients would complain of a red eye, abnormal sensations to the eye, in the sense there could be a burning sensation to pin-pricking sensations. There could be frank itching, eye pain. So a lot of that we are seeing regularly in our OPDs. Red eye, of course, watery eye, sticky discharge to the eye, photophobia, or sensitivity to bright lights, if I may put it that way. So stepping out in the sun could be of some concern. Working in front of your laptops could be of some concern. Having said that, every red eye cannot be conjunctivitis. So it is extremely, extremely important that we consult an eye doctor before doing a DIY treatment for ourselves and our family members. Every conjunctivitis is different. So when patients ask me if they can share their drops between family members, it's a big no-no. Because some people might need stronger drops, the others won't. So it is not justified to have a very common treatment protocol for every member of the family. Okay. And also a big no-no from my side to the very commonly available over-the-counter medicines. That is what we're generally seeing. They have a lot of strong steroids in those eye drops, not warranted at all for the current eye flu that we're looking at. Okay. All right. Now, if we talk about preventive medications, there are none. Because the concept is the same as COVID. If we would have any preventive medicines, we would have not allowed the infection to build up to a massive scale that we're looking at currently. So do not fall for anything preventive. It is only about those same 3 protocols that we need to remember that we followed during COVID, famously called the COVID protocols. Number 1, hand hygiene. Please practice the 20-second hand wash regime and the hand sanitization as much as we can, especially if we are a caretaker to the patient. Second, if the patient around us has upper respiratory symptoms in the form of a cold, a sore throat, cough, ask them to mask up. If they cannot mask up, we have to mask up, right? And third is social distancing. Avoid visiting overcrowded areas, avoid the pools at this particular point in time. Only if it is really, really important, then venture out in public gatherings. treatment is symptomatic. Somewhere between 4 days to 14 days is the duration of the current illness that we're looking at. And it all depends on how strong your immunity is and what fight the body is putting back. So it is variable for every individual. Some people have a massively swollen eye, some are very comfortable. It's very variable. So I recommend every patient, however mild or however severe the symptoms be, please visit your nearest ophthalmologist for a proper treatment.
I have a few questions. This was largely a parent question thing. So can I ask them now?
Yes, please go ahead, ma'am.
Okay. So my son has this sort of inflammation in the eye, and I'm scared to take him to the doctor because वहां जाके और infection ही ना हो जाए. So what should we do?
So point number one, get rid of that fear, because like I said, a DIY treatment could be more detrimental to the eye health, right? At the clinics, we are practicing hygiene. We are sanitizing our machines after every infective patient. So do not
Achha.
worry, right? So there are measures that we are taking from our end. From your end, what you can do is wear a mask. And like I said, hand hygiene. We all have a habit of touching our face with infected fingers. So try and avoid touching your face as much as possible, because entry points are three: the eye, the nose, and the mouth, right? So avoid touching the face. Again, very, in bold letters, I would like to highlight hand hygiene is the key to safeguard yourself from any viral infection, not only this particular.
Okay.
So
दूसरा,
please visit, do not hesitate, because even an online consultation is not adequate enough. There are limitations to an online consultation.
okay.
Unless we see the patient under a microscope, we do not know the extent to what the infection has gone up to and whether my cornea has been involved or not, which is again a different complication and needs to be treated accordingly. So do not hesitate.
Okay. Secondly, you just spoke about this upper respiratory infection, etc. So is there a linkage between conjunctivitis and cough, cold, etc.?
Yes, so we are looking at patients complaining of sore throats, painful swelling, that is lymphadenopathy in this area, right in front of your ear, and cold, rarely cough, and very rarely abdominal symptoms. Now, because this is a flu, it enters your bloodstream and it is going to circulate in the entire body. How good a fight the immune system will put up will decide how many organs are involved and the duration of the illness.
Okay. And after my child has become better, how soon can he go back to playing such that, he doesn't infect his friends?
Right. So active discharge needs to stop, be it sticky discharge or a just plain teary eye. The redness has to come down. The fever has to come down. The child has to be comfortable. Like I said, there is evidence of photophobia. That means bright lights could be of some concern to the patient. So once the child has gotten over with at least 3 or 4 of these symptoms, he's fit to resume school, fit to go to play, fit to interact with other patients,
Okay.
people in general.
Okay, wonderful. Now, if he is down playing and then I realize that one of the other children has it, how scared do we need to be?
There is nothing to fear, but we have to be vigilant. Now, if we realize that our child is showing early symptoms of an infection, the host of the list that I just gave you, then we have to limit ourselves, we have to restrict our movements and then not allow the child to mix around with other people.
In the
to attend-
family also?
Yes, why not?
Okay. So if there
As
are
a
two children, then I
family-
need to keep them apart.
Yes, as a family, we generally have a joint family. There are elderly patients, they are immunocompromised, they are diabetics, hypertensives, we are looking at patients with kidney failure. Then severity of infection is massive,
Okay.
right? So a child could probably get over the infection maybe in 3 or 4 days, but elderly patients would then contract the infection from them, probably could last for at least a week or 10.
Okay.
So isolation, of course, is of great help to break the chain.
Okay. Does this conjunctivitis have any long-term effect on the eye, whether on kids or senior?
Not that we have recorded any.
Okay.
In the sense, there is no loss or blur of vision. There is no change in your spectacle power. Yes, a few patients do experience dryness for a certain period of time after healing. That's because of some inherent changes in the tissue that happen during the recovery process. That is also a manageable thing. Nothing permanent, I would say. Yes, but extended, yeah, for a couple of weeks, probably one might feel the photophobia, some sensitivity, and dryness, for which moisturizing drops play the most important.
Acha. And Doctor, my last question, thank you for taking all these questions so patiently. My child already has dry eyes, so is he more susceptible to conjunctivitis?
Tears play an important role in preventing infection. They have these chemicals that fight back any kind of foreign exposure. So if we are deficient in tears or if we have a dry eye, we are not only going to be sensitive, there's also going to be an increased tendency to contract infections very easily.
Okay.
So primarily, we need to ensure anyone and everyone with a dry eye needs to moisturize their eyes on a regular basis. Now, we're living in an era where mobiles, iPads, laptops, they are a thing of regular use. Even if somebody doesn't have to use these gadgets, we're all sitting under LED bulbs. So the exposure to these blue wavelengths from gadgets is going to cause a dry eye for sure. And recommendation is for everybody, because dry eye is a very subjective phenomena. A severely dry eye patient could be absolutely comfortable, while a very mildly dry eye patient could be very, very uncomfortable as well.
Okay. Okay. So
need to moisturize, need to protect, need to have a healthy lifestyle so that our immunity is robust enough to deal with epidemics and pandemics that we've been seeing all over this past couple of years. So like I said, COVID, all of us contracted COVID, but unfortunately, a few of us did land up in the hospital. Again, that was related to immunity. Every viral infection, the only key factor that determines the outcome is your immunity.
Right.
And no immune boosters can change your immunity, say, with just 1 or 2 pills. You can't go from 1 to 100 in just 10 seconds with immune boosters. It's a lifestyle, it's a commitment that you need to show. So we need to build that over time so that we are strong enough as a society to fight back these epidemics whenever they occur.
Right. So thank you so much for your time. This has been a very enlightening session.
Pleasure, pleasure. Thank you so much for having me.
All right. Bye-bye.
Bye-bye. Take care. Thank you.